Hey guys, it's Danielle with Pure Root Wellness. Today we're going to talk a little bit about headaches and migraines. So, what is a headache? The physiologic or physiology, I should say, of the exact cause is still really unknown. It's thought to be kind of a blood vessel issue within the brain that maybe undergoes spasms and then causes a constrictive kind of process within those blood vessels and then a rapid dilation. This kind of ultimately triggers a release of some chemicals within the brain that can cause inflammation and that sensation of throbbing pain. Typically, you're looking at more women than men are affected, and there can be a strong hereditary factor kind of encompassed within either headache or more so migraine diagnoses. But, symptoms can be different from each person to person. Usually it's a sensation of a tight band around the head, tension in the neck or shoulders with pressure, throbbing anywhere in the head or neck. Migraines are obviously a little more severe, usually on one side of the head. Vision disturbances can accompany the pain and proceed to, the head pain itself. With the head pain, the visual disturbances, and then sensitivity to light, nausea, vomiting. And sometimes these migraines can last for several days, which is really debilitating to a lot of patients. So really finding out the root cause of, not from a physiological standpoint, but a trigger standpoint is key. So people who know they have migraines, they know if XYZ kind of happens, I know down the pipeline I need to be concerned that a migraine could shortly ensue. But emotional stress, fatigue, allergies, sinusitis, eye strain from, we all look at the computer 900 hours a day, poor posture, TMJ with grinding of the teeth, alcohol, caffeine, smoking. Sometimes low blood sugars can trigger some problems, hormonal problems, females around each time of the month, and then nutritional deficiencies, which we'll kind of get into as well. So working to prevent migraines, obviously starting with the diet is always helpful. Avoiding food additives, again, that whole plant-based meal is just going to tee you up. There's tofu in the back. Whole plant-based meals are going to tee you up for success from a overall healthy perspective. But keeping your blood sugar nice and steady, not having a lot of, fluctuations in your blood sugar is very important. Water, more water, flushing out that system, keeping your body hydrated, keeping those blood vessels hydrated, and not giving them the opportunity to possibly spasm and constrict. Calcium and magnesium help with prevention. A little typo there. A drop in magnesium levels have actually been noticed in some people with migraines, and or they're actually lacking this mineral prior to the migraine even starting. So something to kind of be aware of from a nutritional standpoint. And then low riboflavin, really causing low energy levels, may also be a factor to consider as far as a mineral deficiency goes. And then keeping a good diet rich in omega-3 fatty acids. So using good fishes, supplementation if you need it. So foods to avoid, really keeping a log of what foods may have triggered the headache or migraine. But all of these foods and compounds that are on this list are kind of stayaways anyway, right? I had talked about in previous, my preservatives, additives, and like food colorings podcast were nitrates with the bacon, the hot dogs, the cured meats, pepperonis, red wines, chicken livers, aged cheeses, the tannins with, the coffee and red wine, sulfites with the red wine and dried fruits. Avoiding MSG is very important. And then consider limiting chocolate, artificial sweeteners like aspartame. These are all preservatives and additives that make your body kind of question, what did you just put inside me? And then kind of give you a reaction to being confused at the chemical compound that you just put in your body, and your body not really knowing what to do with it. The migraine or headache alone is just a way of your body to tell you, hey, I don't know what this is. don't keep giving it to me. You just may have a more profound reaction than, say, another individual. So ways to help: keeping foods rich in magnesium, about 200 milligrams twice a day or 3 times a day. Amaranth, avocados, rice, winter squash are all really good foods to kind of help with this. Or again, just supplementing with a good daily mineral. Foods rich in riboflavin or B2, about 400 milligrams a day. We're looking at broccolis, mushrooms, quinoa. And then here are a few herbal extracts that can kind of help, butterbur, feverview, coenzyme Q10. That was interesting. Coenzyme Q10 actually decreased the frequency of migraines to about 50%. And then 5-HTP. This is something that directly affects the body's serotonin levels. But if you're on something for antidepressant or anti-anxiety, you really need to talk to your healthcare provider, your naturopathic, your functional health medicine doc, someone prior to incorporating this 5-HTP as a supplement. Or tryptophan, in turkey and certain foods actually can kind of help with this as well, to naturally, raise your serotonin levels. But something to just consider, that you need to actually talk to a provider before incorporating some of these into your diet. But massage, acupressure, reflexology, aromatherapy, homeopathy, i.e. they use like belladonna. Again, I would encourage a naturopath guiding this, or an herbalist, or someone who is very keen and up to date on how to do it properly and appropriately. But just something to kind of put in your back pocket and hold on to, in regards to having something in your arsenal for the next time you develop a headache or a migraine. Tips on just prevention and foods to avoid and foods to incorporate, I think can help guide anyone on knowing what their body, is telling them when these migraines, debilitating headaches and migraines kind of occur. So I hope this was helpful. Just a couple little nuggets of knowledge. If you have any comments, questions, concerns, suggestions, go ahead and pop them down in the bottom there. But I hope you all are well, and be well. Thanks, guys. Talk to you soon.